Today's topic is high blood pressure. Blood pressure refers to the pressure that blood applies in the inner walls of the arteries. Arteries carry blood from the heart to other organ parts of the body. Hypertension is the medical term for high blood pressure. An individual's blood pressure is defined by two measurements. Systolic blood pressure is the pressure in the arteries produced when the heart contracts. Diastolic pressure is the pressure of the arteries during relaxation of the heart. Blood pressure is defined as systolic blood pressure over diastolic blood pressure. For example, 100/70. Untreated high blood pressure increases the strain in different body parts, including the heart and the arteries, eventually causing body organ damage. High blood pressure increases the risk of heart failure, heart attack, stroke, kidney dysfunction, and death, among others. A normal blood pressure is a blood pressure less than 120 over less than 80. Elevated blood pressure is a blood pressure from 120 to 129 over less than 80. Hypertension, stage 1 would be a blood pressure between 130 and 139 over 80 to 89. Stage 2 is a blood pressure at least 140 over at least 90. Most adults develop primary hypertension or essential hypertension. The reason for the high blood pressure is not necessarily known. Some other people may develop high blood pressure due to other medical problems. It could be either kidney or hormonal or other. About 46% of adults have a diagnosis of high blood pressure. It is more common as people get older. Many people's blood pressure is not well controlled. About 47% of adults have controlled blood pressure. There are several risk factors for high blood pressure. The risk increases when the person gets older, have obesity, have a family history of hypertension, is a Black person, consume a lot of sodium in the diet, drink a lot of alcohol, do not get a lot of physical activity. High blood pressure usually does not cause symptoms. It is usually diagnosed in routine physical exams. Anyone that is 40 years old or older with no history of high blood pressure should get screened for blood pressure at least once a year. More frequent screening should happen if the person has risk factors or has had high blood pressure. Untreated hypertension can lead to multiple medical problems, including heart disease, kidney disease, and death. The risk of these diseases may increase if the blood pressure is higher than 115 over 75. Treating high blood pressure daily can reduce the risk of a heart attack, stroke, and death. Treatment of hypertension usually starts with lifestyle modifications, reducing the amount of salt, losing weight, avoiding drinking too much alcohol, stop smoking, exercise at least 30 minutes per day. Medications are available to reduce blood pressure. They are recommended if the pressure is consistently elevated, usually when it's above 140 over 90. It may be recommended in other circumstances. Treatment with medication is recommended at a lower blood pressure for some older people and for those with atherosclerosis, meaning coronary heart disease, stroke, peripheral artery disease, diabetes, chronic kidney disease. So some of the treatments include reduced sodium or salt, reducing alcohol use, Drinking more than 2 drinks of alcohol per day increases the risk of high blood pressure. Eat more fruits and vegetables. Eat more fiber. The recommended amount of dietary fiber would be 25 to 30 grams per day. Eat more fish. Excessive amounts of caffeine may increase blood pressure. Regular exercise can reduce the blood pressure. It is recommended to walk 150 to 300 minutes per week. Aerobic activity and muscle strength at least twice per week. Exercise controls both blood pressure and cholesterol. Losing weight helps to decrease blood pressure. Avoid taking medications and supplements that increase blood pressure. Medications, for example, like ibuprofen or naproxen, may increase blood pressure. Oral contraceptives may increase blood pressure. Some medications included in nasal decongestants, illegal drug use, certain weight loss treatments. There are different medications available to help lower the blood pressure. You should always talk to the provider to determine which medicine would be the best option for you if you need a medication. And also remember to discuss the potential side effects of treatment. And if the person is having a side effect, they should discuss the side effect with the doctor or the provider to make sure that another medicine can then be used or the dose can be lowered or adjusted. It is important that once the person starts taking medication to lower the blood pressure, the person takes the medicine as directed. Thank you for watching. For other health topics, please join social media such as TikTok, Instagram, and Facebook, and YouTube.